My name is Shelby Allen. I've been a nurse for 8 years now. My specialty is cardiac.
So I'm Tessa. I got into nursing straight out of high school.
My name's Megan. I got into healthcare. My mom is a nurse and my parents have both worked in healthcare since I was small.
So we have a few clips for you on medical shows. So we're gonna get started with the first one here.
Did you actually just page me to find out how much Tylenol to give to Mrs. Lenzner?
I was worried that it could exacerbate the patient's...
It's regular strength Tylenol. Here's what you do. Get her to open her mouth, take a handful, and throw it at her. Whatever sticks, that's the correct dosage. And under no circumstances are you to compromise our no talking agreement.
Yeah, I have definitely been talked down to by a doctor having a call about Tylenol. But what people don't understand that is if I order Tylenol on my own thing, I am practicing outside of my scope of practice because I am prescribing medication in a hospital setting. Yeah, sometimes I have to call and say, hey, I just need Tylenol because my patient has a headache. And there are some doctors that are like, are you freaking kidding me? And I'm trying not to get in trouble and practice outside of my scope of practice because, that's my license on the line. People just think, oh, it's just Tylenol. But then, the doctors are also supposed to kind of do a little bit more critical thinking as well as we are as nurses. And, if I have a patient that's in liver failure, I'm not going to want to give them Tylenol. And so sometimes, we just have to help each other out and whatnot. Some hospitals have what we call standing orders. So if it's something like that for Tylenol, it says, okay, hey, if their liver labs are within, normal range, they can have regular strength Tylenol to treat, headaches or whatnot, or a fever. And hospitals and doctors nowadays too put on what we call PRN orders, so as needed orders. And Tylenol usually falls under that. And they'll have like stipulations for pain levels or what the pain is for. Because if a doctor says, okay, this is for fevers, but my patient's complaining of a headache, I also have to be careful and I have to clarify that order and I have to get that clarified under indications and put headache under there. Because again, if I give Tylenol for a headache, but it's only indicated for fever, I'm acting outside of my scope of practice, so.
Did you actually just page me to find out how much Tylenol to give to Mrs. Lenzner?
Oh, this is real
I was
life.
worried that it could exacerbate the patient's...
It's regular strength Tylenol. Here's what you do. Get her to open her mouth, take a handful, and throw it at her. Whatever sticks, that's the correct dosage. And under no circumstances are you to compromise our no talking agreement.
I know a doctor just like that.
Same. I've had a doctor be like, call me when you actually know something. Click. I'm like, okay, thanks. Yes. You know what? We try to teach our students too. Like they all consume this type of media. They know about the mean doctor. And I'm like, in the classroom, like if you don't know what you're going to call them about, they will be mean to you because some of them are people. Mm-hmm. Like they get irritated and frustrated when somebody calls at 2 a.m. over Tylenol until they have that first phone call where they say like, how much Tylenol do I give? And the doctor says, you should be smart enough to figure it out.
There are things in every healthcare setting called standing orders. Mm-hmm. Tylenol is included in every set of standing orders I have ever encountered. And if you have a Tylenol order and it's not clear, just use your standing order and then say, hey, I gave this much Tylenol initiated by the standing order.
Yeah.
Those things actually do happen.
Yeah.
Just like that.
I think every unit's a little bit different, but overall, we're all people and doctors are people. And, I'm sure I've been rude at times, but I've definitely been on the receiving end of that type of rudeness.
I have, but it only happened one time, so.
Mine's happened more than once.
Last pulse en route, 4 minutes. Car crashed into a construction truck. Post came through the windshield.
On my count, 1, 2, 3.
Alter, BP 70 over 30, dislocated left hip.
Ross, take over compressions.
Holy crap, this is Drake's in. I got it.
I said Ross, Dr. Avila, you are not a character in his movie. This is real life. Let's go.
Ready, pulse, full extremity, so you're shocked.
I think that gives a good example of like how chaotic things can get when you see how many people are just going and yelling and this and that. And, I never worked ER or trauma and whatnot. And so I don't necessarily know a lot about that. But one thing I will say is I'm very surprised that the guy was not intubated en route or and whatnot. They intubated as soon as he got to the hospital. I mean, usually if they code on the way, but again, I'm not an EMT or a flight nurse, so I'm not sure exactly what happened there.
We need to activate the massive transfusion protocol.
Already did that from dispatch.
Sonia, is there anyone you want us to call?
Oh God, why? Is he dead?
No, we're working on him.
Call my daughter, please. Her name is Delia.
Look out, coming in.
Right, nurse, he's been down 6 minutes. Need epi and blood. My phone's in my purse. Call Andrew Ferryman. He needs to be here too.
His agent, seriously? Go make the call.
Okay, left leg is shortened and rotated internally.
Okay, you've got a dislocated hip and we're gonna have to put it back in, all right? So I'm gonna get you some meds.
Drake!
Somebody give me the bullet on Mr. Finn. Got a call from the board.
Rocks, this is the driver. We've got a pipe that came through the windshield and impaled him. Vitals are unstable. Lost pulses en route.
Page Dr. Layton. Tell him to have an OR ready. I need an ultrasound over here now.
What did the board have to say?
Don't let him die.
Drake, honey, talk to me.
Okay, this is gonna be painful, but it's gonna be fast.
Just do it.
3, 2, 1.
I've seen doctors reset bones in yard, and it is quite that disgusting too. That's one thing I can't do it. It makes it like makes me cringe. And there's some things that even as a nurse that I'm like, oh, can't stand. I can do blood, gut, gore, all that stuff, but trying to put a bone back in place, it gets me.
Okay, pulse is good. Get her off the board. All right. Whoa. Let me get some tape over.
We got a fractured arm.
Right away.
We'll splint it later, all right?
Okay.
Okay, pulse is back. Good job.
Ready?
He's weak. Are you ready to move on?
Stop. Impalement is millimeters from the aorta. Could sever any moment. One wrong bump to the gurney and he is gone.
And this is just my own opinion, that I thought was kind of funny that, you know, he said stop, one wrong bump, and you know, this aorta is gonna blow, but he just went on a full-blown helicopter ride. So I mean, if it was gonna happen, it was probably gonna happen in there, getting on and off and whatnot.
What would you say to someone who's interested in healthcare? I
would say make sure you have a passion for people. You have to have a certain level of caring for the people to want to treat them, to want to learn, and to want to do better.
What would you say to someone who's interested in healthcare?
So I was actually thinking about this on my way to work today, that I am the one out of my peers that loves my job. By getting this degree, by having my nursing degree, I get to wake up every day and be a part of somebody else's life and impact them in such a cool way.
And I think that there's so many different aspects of healthcare. So even if a 12-hour shift on the floor taking care of 7 or 8 patients isn't your jam, there's always something for somebody.
Look at us now, we're teaching.
We're teaching. There are nursing positions where you can work from home. You can work in a Fortune 500 company as an occupational health nurse, or you can get down and dirty in the ER.
But like working in healthcare, you really get to make a difference.
Thanks for watching. A big thank you to Shelby, Tessa, and Megan for joining us today and sharing their expertise. Nurses make a big difference in our lives, and nursing is in high demand right now. Being a nurse, you can make about $60,000 starting out, and it can definitely go up from there. And if you want to learn more about nursing, check out your local technical college. If you enjoyed this video, make sure to like and comment. YouTube Analytics says only 1% of you are subscribed right now, so make sure to hit that button, and we'll see you next time.